Welcome, everybody. My name is Louise Blasius, and I'm with the McKenzie Health System Foundation and our Healthy Lifestyle Committee. I will be serving as moderator for today's town hall event. We're holding these events for our community members, and we're very pleased to have you with us today. Our panelists include Dr. Steve Barnett, President and CEO of McKenzie Hospital, Dr. Mark Hammond, McKenzie Medical Director, Bryant Wilke, Director of the Sanilac County Health Department, and Duane Lange, Superintendent of the Intermediate School District for Sanilac County. I would like to go over just a couple of housekeeping items, and then we'll launch into our topics for today. First of all, your audio is automatically muted. Please use the question and answer function at the bottom of your screen to send us a question, and we welcome your questions. Also, this town hall will be recorded and a link will be sent in an email so that if we run over during our question and answer period, feel free to jump off the webinar and you can watch the recording at your convenience. Our topics today include COVID-19 updates for the community, testing options for people in Sanilac County, the impact on our Sanilac County schools, and a question and answer period for you. Dr. Steve Barnett will kick us off by sharing hospital updates for our community.
Thank you, Louise. I appreciate the introduction and very grateful to be on this panel. We have got some real horsepower here with Mr. Lange and Dr. Hammond and Bryant from the health department. These guys are all have their finger on the pulse of what's going on. You're going to get a little bit broader update in terms of COVID, but I'm going to focus narrowly on the hospital and where we are today. So you'll get that broader update from Dr. Hammond and Bryant. McKenzie Health System, we are continuing to limit visitation. We screen everyone that's entering the facility. We require everyone to wear a mask. And we have waiting areas set up for physical distancing. So we've done a lot of those things internally that you're going to hear repeated over and over again that you need to be doing as a member in the community. Cleaning continues to be a priority. Both in the hospital and also our off-campus offices. It often feels as if it's just a matter of time before we at McKenzie will experience some sort of outbreak. I know that the slope on the curve of positivity in this county is moving at an alarming rate, and we're all concerned about how that's going to impact us in our organizations. What I can say is that so far, the staff at McKenzie have been vigilant, and we've managed to keep COVID outside the environment. You're going to hear, as I said earlier, from both Bryant and Dr. Hammond about the state of COVID locally. But what I can tell you is that it's concerning what we're seeing in the county and in the state and nationally. And what it does is it puts us at risk as a healthcare facility if we're not mindful in the community and everybody is doing what they can to try and limit not only becoming infected, but also exposing others. There's a website, our website. If you hit a COVID tab, you'll find a nice diagram. If you're thinking about having testing done or you want to be tested, that will kind of walk you through the steps that you might want to consider as you figure out how to get that test done. In terms of testing at McKenzie, I can tell you that our lab director, Nate Petrie, had the foresight very early on in this pandemic, which I mean back in March and February actually, to review and identify the best instruments available for PCR testing. And For those that care, PCR stands for polymerase chain reaction, but that is the type of testing that we do here that requires that deep nasopharyngeal swab. We were able to secure the instruments, and of course, having the instruments and validating them and making sure that they're providing the level of testing specificity and sensitivity that we're accustomed to here is half the battle. The larger problem is securing supplies to support the testing on the instruments. So what I can tell you is we've been using one instrument that does have COVID as part of the panel, and we use that pretty much exclusively for the emergency department and pre-surgical testing, as well as some other testing that needs to be done more immediately, as with the school system, for example. If we can get the test supplies, and we've been waiting for 2 or 3 months now, we'll be able to offer some of these others as well. The real advantage is that with the one we've been doing, it has a number of pathogens that it looks at besides COVID. So if you're not COVID positive, but you still have something going on from a respiratory standpoint, we'll probably be able to identify that for you and treat it as well. We are capable of running antibody tests, but at this point, we've not found a whole lot of value in that. I'm sure Dr. Hammett could speak to this more deeply than I, but with the positive case rising and vaccines on the horizon, there may come a time in the not too distant future, as time travels, we know that people are exposed, they may be developing immunity, and we may want to begin to offer that antibody testing and see just what the level of immunity is in our community. So that may be something we need to do, but we can do it here. And then I just want to remind everything that PCR testing, which is what I've been talking about, is considered the gold standard when it comes to identifying whether or not you have or have not been exposed and come up positive for COVID. There are a lot of rapid tests that have sprung up around the country and certainly in our area. And what we've determined is those are really best suited for screening populations. But if you have somebody who's symptomatic and coming up negative on that device, odds are you'd want to come over and be re-examined with our testing. And then we can make sure that you don't have a false negative that's coming out of that rapid test. So having said all of that, and I know it's been delivered quickly, I'd like to turn it over to Dr. Hammett so he can provide some deeper insight, not only to Sanilac County, but the other counties you represent as the medical director for public health.
Thanks, Steve. Hey, everybody. As you have read in the news, newspaper, online, there's a lot of cases throughout the whole county and the whole state, the whole country for that matter. There's currently on average 1 American dying per minute in the United States, 1,700 deaths per day, which is absolutely sad and preventable for the most part too. So what we'll do today is we'll talk about what this all means. Why are we seeing an increase in viral cases at this point? So not surprisingly, we're seeing a lot of cases now. Now, why did I say not surprisingly? Because we know that COVID-19 is following the viral trend that we see. Usually in colder weather, the virus is more stable, can live longer in colder temperatures. And a lot of people are indoors now with not the greatest ventilation. So the viruses do spread pretty easily that way. So what we have in our defense are these annoying masks that we all hate wearing, right? But they do work to a degree. So with all these cases increasing, what does it mean? Does it mean we're doing a bad job? No, it just means the virus is kind of spreading as we expected it would spread. The key is going to be is limiting the spread as best as we can. Why? To not overwhelm the hospital systems. Because when we overwhelm the hospital systems, we put everybody else at risk. We put those who present with other issues going on, strokes, heart attacks, other emergencies. We put their care second, and we overwhelm our local hospital systems as well as other hospitals too, and that could affect care down the line to everybody else. So wearing the mask and being safe and practicing safe hygiene and hand washing is going to be important to help protect yourself and your families. and also to help protect your neighbors and not overwhelming the healthcare system for everybody else. We're seeing a lot less deaths, even though, we're seeing a lot of deaths currently. We're seeing less than we were earlier in the pandemic. Why? Probably because of these annoying masks, right? So studies have shown that wearing the mask, not only do you help protect others against getting COVID from you if you have it, when you don't know you have it. However, we're seeing that even these masks are not 100% effective. They're not. Even the cloth masks are not, 100% effective. Even those N95s that we all hear about are not 100% effective. However, we do know that if you do contract COVID while wearing a mask, odds are you're getting less of that viral particles into you, so you're getting less sick. So in a way, you're getting some kind of immunity for a really low cost. You're not getting super sick as we were seeing earlier in the pandemic, but we are still getting little symptoms too. So again, wearing a mask, it's not 100% effective, but it's effective up to the point where you'll get probably less sick getting COVID. Probably less need to be hospitalized too. And then for those that are hospitalized, we're doing a lot more different things than we were earlier in the pandemic. Now we know that a lot of these patients can do well on high flow oxygen instead of being intubated. So we're getting less people on ventilators. Still a lot of people in the ICU, however, less people on ventilators, which is life support. We're seeing there's more therapeutics now than we knew before. We're learning a lot more about what to do and not to do with this disease. Initially, we were told don't ever give steroids to a patient that has COVID. You're going to make them worse. The exact opposite. We're seeing actually a beneficial result of using steroids. There are some therapeutics that were approved by the FDA recently that helped limit how sick people can be with COVID, especially those who are in the hospital. And there's a new medication out for those who are at high risk of getting very sick to be given early on to help prevent them from getting very sick. It's a monoclonal antibody. It's brand new out this week, and they'll probably ramp up production over the next few months too. Then we have that vaccine. We have multiple vaccines in the pipeline. We have 2 crossing the finish line currently. And I'll be very frank. I tell all parents, all people that get a vaccine, do your homework. Don't just agree to any vaccine. Know how safe it is, how effective it is. Know the side effects. A lot of vaccines you will get and are going to be about 55, 60% effective. And that's considered great. 6% is considered a good rate for effectiveness. The ones that are coming out are 95% effective. That's amazing. That is absolutely amazing. So again, for those that aren't big vaccinators, do your homework, do your research. Don't just dismiss it off the bat. Just really look into it. Because in order to get this herd immunity we all talk about, the way we're going to get through that is through vaccinations, not through letting it rip through the community and getting sick and dying. We're not going to do that. It's not going to be effective. We're not going to do that. This is not a benign virus. It is for some people, but there's a handful of people who will die from this. And it's not worth letting people die in order to achieve this temporary herd immunity through getting sick. So the vaccines are around the corner. So we're not there yet. So we have to do things in order to help prevent this from spreading worse. Stop panicking. Stop watching the news if you get freaked out by watching the news. Don't go to big crowded events. Avoid congregating. Open a window in your house if you have people over. Wear a mask in your house if you have guests over that you're not sure where they've been. Live your life. Be happy. We'll get through this together, but we still have work to do. And Bryant?
Bryant, you're on mute.
There we go. Better? Thank you, Dr. Hammond, and thank you to the McKenzie group and the foundation for sponsoring this today. A little bit about our numbers. Statewide, we're seeing, as Doc had indicated, significant increase in positives and as well as deaths. Statewide, we're at 277,806 confirmed cases, 8,190 total deaths or associated deaths with COVID. And up to date of the 18th, just yesterday, 5,772 statewide cases, and just yesterday reported out 62 deaths. So what does that mean locally? We've had 457 total cases in our county within that would be residents of Sanilac County. We currently are managing 190 plus or minus cases, and people drop off those cases after 14 days and they've been in quarantine or isolation. So those numbers will fluctuate. And that's why you do see a little bit of fluctuation in the numbers. What we report out is what the state's reporting out. Those are dropping off, or those have been assigned to a different address. So things like that do happen. There's no conspiracy behind those numbers. They are what they are. And we try to keep up to date to them as best we can. For a total fatality within our county, we've had 10 total fatalities from COVID or associated COVID. Just recently, a 60-plus-year-old individual passed in the last couple of days. So what we do look at, too, is the percentage of positives coming out of testing. And we've had a significant increase in positives since October 14th and November 14th. These are the latest statistics. Back in October, we were seeing 1.6% positive rate coming out of testing countywide. And today we're seeing 5.4%, a 3.8% increase in those that have contracted and are being tested and shown to have the virus. So that's a significant increase over just the last 4 weeks. We know when we hit the area of 4.5 to 5%, we get really, really concerned, because we know the higher the positivity rates are, we know we're going to have much more hospitalizations or people seeking medical care from the medical providers. Countywide, we're testing right now today, and this is countywide from all the providers as well as the health department, 250 individuals per day on an average, and that fluctuates from day to day. Our health department, we run the testing drive-through. Now we're over at the Sanilac Transportation Facility, which we really appreciate them allowing us to use their facility and get inside out of the weather. We're seeing 100 to 150 people per week. And so we're there Tuesday and Thursdays from 9 to 11. If you go to our website, you can find the number for arranging an appointment. We're seeing across the board positivity rates between the ages of 20 and 80 years old. So if you look at the statistics on the state website, you'll notice the positivity rates are pretty even between 20-year-olds to 80-year-olds. So that's a little bit different what we saw back in the spring. So it's a little bit concerning. We know younger people are now contracting the virus. And I think that's the reason what effective yesterday. They used some statistics statewide to develop additional restrictions that we went through. If you remember back in the spring, we had some really significant restrictions. Now they're a little bit loose, but they're also targeted towards activities, and they're really targeted towards socialization. We've noticed through statistics and the contract tracing that the state has done, as well as the local health departments have done, as well as us here, that what we're seeing the positive or contacts coming out of are social events. And that could be anywhere from bowling, theaters, eating at a restaurant, things of that nature. So the recent epidemic order coming out of the state has targeted those areas so that we can make an attempt to lower the numbers that we're seeing and lower the numbers of contracting the virus. And as mentioned earlier, of course, we're starting to hear lots about the vaccine coming out. So as a health department, we take a major lead in the vaccinations and immunizations in our county. So we're starting to make definite plans and rolling that out. And of course, the vaccines, when they're initiated and available to us, we will be starting with the higher categories, where they put them in categories, and I shouldn't say higher, but what they call an A1 category would be our medical professionals. So initially, all the vaccines will be utilized to vaccinate all those frontline people in the hospitals and providers and medical care professions. And then secondly, we'll go out to our first responders and school teachers and those folks that have immediate contact with lots of people because of their professional area. And we're really excited, like Dr. Hammett's mentioned, the new technology and how effective this is indicating to be, and availability of it coming out so soon versus another year from now. So we're really excited to get that out. It's new technology, but it's going to be safe, and we're able to manage it and roll it out to our community so we can put a stop to this. But as we wait for that, because vaccines won't be the only tool we have, we go back to what Dr. Hammond mentioned, is protecting ourselves with a face mask, social distancing, and personal hygiene by keeping our hands washed if we are near a hand washing facility, or sanitizing our hands with hand sanitizer. So that brings us up, because Thanksgiving is just next week. So please follow the guidelines out there, and please social distance. There's a new kind of an idea out there. It's called the social pod. It's on the state website, where you can come to an agreement with, I think it's less than 10 people that maybe multiple families talk about this, so that you can be getting together and having some company and socializing with a defined group, so that you do not have to take a risk. And this is very important for our vulnerable population, our elderly, so that they can get out and socialize and, get some of that stress off, because we're all kind of feeling the COVID fatigue. So take a look at that, and that's something you might want to look at as an audience, and share with your loved ones that, hey, if we can come to an agreement that we're not going to risk ourselves by going to parties and things like that nature to desocialize, but we can have a group that we can communicate. And also just check on your neighbor, give them a call, make sure everybody's doing okay in your neighborhood. They need something. If you can't provide it, you should contact here at the health department or community mental health, or any one of us. We will get them assistance as best we can. So with that, I know schools have a lot to talk about, so I'll hand it over to Duane Lange, our superintendent.
Thanks, Bryant. As far as the schools go, as everyone else in the state, the high schools were closed down with the executive order that came out effective yesterday. So all 7 local districts, as well as the Career Center students, are learning virtually, learning remotely, with contact through their teachers using various modes of technology. All the 7 local districts in the county, the K-8 systems are still up and operative, and as well as the special needs programs at the ISD. There was only one ISD program that we closed because it involves all of those kids going into vocational programs. So with the vocational programs closed, those students are learning virtually also. Within the schools, since the start of basically the school year in early September, we have had some cases. They've been limited per se. We've had, throughout the county, I think 3 or 4 different classrooms, entire classrooms quarantines because of an outbreak. We had one of those a few weeks ago at the Career Center, one of our programs, where everyone had to be quarantined. We have had throughout the school year so far several students quarantined due to contact tracing and exposure outside of the school arena. Right now, the real issue with schools, and we meet once a week virtually, the superintendents. We met this morning at 9 o'clock. The real issue, or the concern with us as we move forward, is the staffing issues. As you get more and more teachers out, our sub lists have dwindled due to the COVID and due to just a shortage of subs and teachers in general. So that's going to be the real issue as far as keeping elementary schools open, and hopefully high schools will be back open starting on December 9th. So that's really all I have as far as an update as the schools right now. Like I said, we're encouraging students to log on, stay online, stay on top of what's being expected of them. The staffs are doing a nice job as far as communicating. A lot of them use Zoom, Google Classroom, different avenues. And so that's what we're looking forward to continuing until we're back in person. That's really all I have as far as the schools go at this time, Louise.
Thank you very much, Mr. Lange. So this brings us to the point of our question and answer period. If you have questions, please enter them in the question and answer function. There's still time to do that. And I'd like to call upon Dr. Barnett for one of our first questions, and that is, does the hospital still have plenty of personal protective equipment supplies?
We do, Louise. We monitor and really do inventory at least a couple times during the week. We know that we have vendors out there, as well as through the Emergency Operations Committee, access to regional stores of PPE. So we're fairly comfortable with the supplies that we have right now, but that could be threatened at any time. So right now, when we do our testing, much like Bryant does over at Sanilac Transportation for Public Health, we try to make sure that we register those people and we bring them through at the same time so that we get gowned up and masked and everything for collection once rather than for every person. So that preserves and allows us to continue to extend that supply and inventory.
Excellent, thank you. Now here's a question for Dr. Hammond. Have you read any studies on the arthritis drug Olumiant being used for COVID in the United Kingdom?
Yep, there's actually a study using that medication as well as remdesivir in combination for hospitalized patients. It's actually been shown to actually decrease mortality, death rate in people, as well as decrease sickness in hospitalized patients. So that is an interesting study coming out. It's a very, the medication itself, it's not very well used here in America yet. There are forms of it that are used in America. It's an immunosuppressant rheumatoid arthritis medication, but that's kind of how these medications do work. It suppresses the immune system to a degree, as well as suppresses how sick the virus makes you, allowing remdesivir, the antiviral, to work really well better.
I also have a related question for you, Dr. Hammond. Do you have to be hospitalized to receive remdesivir, or can you be prescribed that to take it home?
Right. So currently, remdesivir is only an IV formulation, so it has to be given in a hospital setting. And typically, they're for those who are moderately to severely ill with COVID, because there's still a limited supply of like remdesivir out there. So they want to save it for those very sick people. COVID.
Thank you. Mr. Wilke, I'm not sure if you can tackle this one. It says, will residents of a medical care facility get the immunization first, or will it be medical staff?
I think it will be medical staff, but they'll be included in the first round of immunizations or vaccines. So both the staff and the clients or those being cared for, because they are a vulnerable population.
Okay, very good. Early on in this pandemic, we heard about the potential long-term negative health consequences following recovery from a serious case of COVID. Dr. Hammond, could you speak to that potential a little?
Yep. So there are some very common, we call long-term or long hauler effects of COVID. Typically, we see a lot of people who, after they're in the recovered, meaning not contagious anymore phase, we see them still with fatigue, shortness of breath, the cough will linger for weeks sometimes, headaches. Some of those subset of people will actually go on to develop longer intermittent chest pain. If they have asthma, it'll make their asthma worse in some people. We're seeing some athletes that have had what they call cardiomyopathy or myocarditis, inflammation of the heart muscle after they recover. So there are some long-term effects that we're still learning more and more about in which populations and maybe how to prevent them too from coming on.
Thank you. And here's a question, I think maybe for Dr. Barnett and also Mr. Wilke. Is there a charge for testing?
Bryant, you want to handle how you're collecting that information?
Sure. There is no charge for our testing. There is, if you do have insurance, we do take that information, and that information is passed along to the lab where they do invoice to the insurance company, but there's no copay or deductible that's needed. If you do not have any insurance, we do have a arrangement with the state lab, and they will run the analysis for cost. So there is no cost to anybody to have a test done through the health department.
Thank you. And what if you get a rapid test ordered by your family physician, Dr. Barnett?
If you have one ordered by your primary care physician, you could, and they should be giving you some direction. If there's somebody within our system, they would follow the flow chart that you can actually see on the webpage here at McKenzie if you wanted to look at that. But that they would schedule you over here. We'd make an appointment, collect the information that Bryant was referring to that allows us to process that test, and then you'd be scheduled to come through. There are days, seems like every day actually, twice a day, I see a line of cars that extends out onto the street, and that means we're taking in 10, 12, 14 people at a time and collecting specimens on them.
Louise, I'll just add on too that as Steve mentioned, as Brian mentioned, all testing is not equal. So the best test is, as Steve mentioned, the PCR, what we call the send out test, or McKenzie, we have that 1 hour rapid one that we reserve for certain patients who we need a result right away for. However, there are tons of urgent cares offering these rapid antigen testing, even CVS does. However, they're only good within the first 7 days of being sick with COVID, because if you're feeling fine and get tested with one of those, there's odds are that test might result as being a false negative, meaning you really do have COVID, but it looks like you don't. And that's giving people a false sense of security. So again, if you feel sick, you feel like you might have something going on, I would at this point assume you do, because we know it's in the community. I would assume that you do have it until you could get a test to show that you don't have it. And that test, if you feel sick, get that PCR, get that send-out test, or come to McKenzie, but don't get that rapid test that might not be an accurate test at outside urgent cares or clinics that offer it. It's really,
right.
To find out for sure if you have it or not, you don't want to risk it, or you don't want to risk it.
I'd like to add to that, because a lot of people that come in close contact with, when they find out that they came in close contact with a positive, they want to get a test done right away to see if they have the virus. And what we're recommending is to wait 48 to 72 hours later to get tested, because you will not have a high enough viral load for that test to be accurate or accurate enough. And Doc, if you want to continue on that, go ahead. But
absolutely, Brian is a good point. So those, it's a common reflex. We're exposed to somebody with COVID. Oh my God, let me go get tested. Don't do it. It's not going to be worth it right away unless you're really feeling sick yourself. Anxiety doesn't count. Anxiety doesn't count as a symptom of COVID that you want to test for. However, so ideally, as Brian said, you want to wait days after being exposed. And, in all fairness, you could not show up positive until the 10th, 11th, 12th day. So that's why we have people quarantined for 14 days if they were exposed to COVID, because there is that potential that you could still flip over and become contagious and show up as positive on the test, up to almost 2 weeks later.
Thank you. I would like to remind our listening audience they can type in a question in the Q&A section. And I have a related question. Does the hospital here in Sandusky keep COVID-19 patients or transfer them?
Well, right from the beginning, Louise, we made the decision that we would transfer patients who are positive for COVID and need to be admitted into an acute care facility. So that was always dependent upon whether or not we had facilities that had a COVID unit that we could transfer to and they would be willing to accept. Back in the spring when we were concerned, and you saw a lot of work around building units at Cobo Hall or whatever, TCF is what it's called now, to house lots of patients because of overflow. We were surprised that we didn't overwhelm those hospitals in that first wave. But I have to say that this third wave that we're in right now strikes me as being more challenging. And we're hearing that many of the facilities we would transfer to are filling up, and in one case was even not accepting patients coming in because they were full. So what we're looking at today at McKenzie is isolating at least 3 rooms in the off chance that we would not be able to transfer somebody who needed to be admitted. They're probably not going to be as acutely ill as we see in some of the transfer facility ICUs, but something that we could manage here. And our goal obviously is to keep that from cross-contaminating anyone else that would be in the hospital. And I would mention too that we also still have 4 negative pressure rooms that we brought online early on. So I think that's been a key factor in how we prevent the rest of the organization from being contaminated, which allows for safety for patients and visitors who may be, or people that are accessing care here.
I do have a follow-up question related to this. What does a negative pressure room mean?
Sure. It means that the air that's in that room is being discharged externally into the environment. So there is no recirculating of potential air droplets that may carry the virus if the patient that's inside that room that we're testing is positive, and that's not then transmitted to the rest of the organization. So it doesn't get into our heating and ventilation system and contaminate or put everyone at risk.
Thank you. And then I'm not sure if you want to answer this question, Mr. Wilke, but it is, when the vaccine comes out, will it be administered by the health department, pharmacies, or the hospital?
That's an easy answer. It's going to be multiple providers: the health department, the hospitals, our pharmacies, all those that we can recruit into being providers for immunizations. We will be utilizing everybody. We have an entire population, 40,000 to do, and we're hoping all 40,000 will step up and accept the vaccinations.
Thank you. Mr. Lange, do you believe the students will be back in school by December 9th?
That's a very good question. Any of the professional organizations that I'm a part of aren't really giving us any leeway one way or the other. They're not, saying probably going to happen, not going to happen. I think it's kind of a wait and see right now to see where the cases go statewide, to see where the cases go regionally. We're in a region with a thumb area that wraps up through Saginaw and goes up north a little bit on the shoreline. So I think they're going to look at that over the next couple of weeks, especially over the Thanksgiving break, and see what happens there. And I'm assuming a decision probably won't be made until like the December 7th, somewhere in that area. But I really have no idea right now.
Thank you. Mr. Wilke, another question is it possible to receive cases by zip code again so we can be informed about the areas getting the virus?
I think they might be referring to updates on our map that we post every week. And yes, we're hoping to do that. We're trying to figure out a little more efficient way of getting those numbers out and trying to be accurate about it. Because of the really onslaught of number of positives, it's slowed our process down a bit, but we hope to get that back up and posted on a weekly basis.
And another question for you. This person says, I like to shop and eat locally, but many local businesses are not masking and distancing. They say we don't have to do that here.
Well, unfortunately, the customers, if they do see that, they probably should just not walk through the door. And all of those businesses and organizations that are not masking up need to understand, yes, you do need to mask up. It's part of the epidemic order. There could be retributions if you're a licensed facility, such as a restaurant or other facilities, and there are fines associated with that. And with the new epidemic order that came out yesterday, or the 3-week pause and the other epidemic orders, we are looking at some type of means from a public health perspective, how not only educate, but how can we convince these operations to mask up. The bottom line is, yes, they do need to. And if you're not comfortable going into the store, really as a customer or patron, let that store owner know that I'm not comfortable coming in because you're not masking up your employees. And there are also the MIOSHA aspects of this. Anywhere is up to a $7,000 fine if they're caught not masking. They're not protecting their workers like they should be.
Thank you. And also for you, Mr. Wilke, will there be a charge for the immunization?
As far as I'm understanding, no. This should be free to everybody.
Thank you. Good news there again. Dr. Barnett, has this pandemic caused McKenzie to change their available services array? Is there any limiting or discontinuing of services?
That's a typical lawyer answer. It depends. With this recent wave, looking at the orders that came out through the Department of Health and Human Services and gathering, we have limited some of the services. So our aqua aerobics, for example, we need to put that, on hold and postpone it because that allows for gathering that would be inconsistent with that recent order. In terms of normal services, we haven't limited anything. We did stop offering cardiac and pulmonary rehab services for a brief period of time during the second wave, but what we were able to do in that same period is remodel another area of the hospital. And that allows us to immediately bring those rehab patients in, have them do their program, and then leave without being exposed to anyone else that may result in cross-contamination. So far, so good. I'm more concerned about what you're hearing from Bryant and Dr. Hammond and the alarming rate of increase of positivity in the county, because although we've been able to keep anyone internally from contaminating any patients or co-workers, what happens when they go outside of here and who they're interacting with and exposed to may result in them feeling symptom-like. They call here, we test them, and then boom, they're positive. And if they're positive, we have to put them in quarantine for 14 days. So that stresses our manpower and our ability to continue to provide services. So we're bumping up against that threshold, as I'm sure most hospitals are. And so that's why we continue to plead with the community to be cooperative and do the simple things that we know help us remain safe and negative.
Thank you. And Mr. Wilke, I hear this question often, and it came to us just now. Could you please explain contact tracing?
Oh, absolutely. So contact tracing is when, let's say an individual becomes positive. That individual is interviewed, and during that interview, we get close contacts that individual came in contact with. And that would be any individual that they may be possibly working with or associated with, that they had been in their presence within 6 feet for more than 15 minutes. So those individuals' names are given to us, and whether the health department or Trace Force, which is a group that the state has organized to reach out to these individuals to let them know that you've came in contact with a COVID positive, and you need to quarantine for 14 days and monitor your symptoms. So we're telling those individuals through contact tracing that you need to be home, quarantine yourself, do not go to work, and monitor your symptoms so that if you do become ill, and of course, during contact tracing, there's continuous, well, normally through contact tracing, there's a continuous touch base with that person from the health department or trace force. But with the significant growth in numbers, it's been less and less contact. So it becomes more of a responsibility of that individual to monitor the symptoms and let us know if they are symptomatic.
Thank you. And Dr. Hammond, I'm going to try this question on you. I think it's a toughie. Is it known how long antibodies actually last? And how will they know how long the immunization will last?
That is a tough question that we don't know the answer to fully yet. We do know that the antibodies that show that you were infected, they spike, they get really high within the first 2 weeks after an infection starts. And then you have another set of antibodies called the IgG antibodies that, kind of rise up for weeks afterwards and can last for months. And then they kind of drop down. Now, what we're seeing is that even 7 months later, there's still a small level of antibody present, but there's what they call, so there's what they call like these T cells and B cells that actually help with the immune response too. So a lot of research is digging into that T cells and B cells to see what effect having had COVID is on those, because those actually produce antibodies. So we're seeing in some people that have a low antibody response, that when they're exposed to COVID again, they ramp up the antibodies to fight against it. So when they seem as if the antibodies were down to zero, all of a sudden they ramp up and fight against it. So there's some kind of memory component to antibodies, to the production of antibodies. So we don't know how long the immunity is for, and to what degree, but we do know that it's lasting for at least several months. Again, because this is such a new virus, we don't know exactly how long for, but that's more information that we'll probably get in the next few months or a year or so. But that's why we say the vaccine will probably be our best bet, because there has been some cases of reinfection throughout the world. It's very rare, but it has happened. So that's why vaccine, what we're reading at least, is that the immunity provided provided by a vaccine will probably last longer than any kind of infection immunity that you might get.
And then a follow-up question is, after you heal from COVID, should you have an antibody test or tests to see how long the antibodies last?
No, I think at this point it might not be, really useful at all. But it might be something to have. I mean, I honestly would, if I had COVID and I was recovered, I think it might be worthwhile to get an antibody test that said you actually had COVID and you have the levels, the IgG. So this way, if there's ever, a decision whether, because right now the guidance is if you've had COVID, the question is, do you need a vaccination or not? Do you need to be immunized or not? There's some data that says you should still get immunized and some that says you don't have to get immunized. So there might be a time in the future where, you're given the option, do you want a vaccine or not? And if you show that, immunity status, I've had COVID before, and the recommendations at the time say you don't need it if you had it before the vaccine, then you might just need to show that and kind of, not need to be immunized. However, the data is still not there to support that, but it's just kind of, down the line, we might need to think about that.
And to add to that, Louise, the antibody testing that we have available today here measures both that initial response, IgM, that Dr. Hammond was referencing, along with the immune response, IgG. But all we're seeing is a qualitative result, which means we're identifying whether it exists or it doesn't. What we're really interested in seeing in the future is an analyzer, and we believe they are there and going to be hitting the market, is one that quantifies how much immune IgG antibody you have in your system. I suspect that's going to be helpful and enhance what Dr. Hammond's referring to.
And then also, I think for Dr. Hammond, how long are you contagious after you've had COVID?
Well, when you first get symptoms, we believe at least 10 to 14 days. But the more important thing is, how long are you contagious before you develop symptoms of COVID? So before you develop the symptoms of COVID, before you develop that cough or fever, you could be contagious for 2 days before that. And actually, you're probably most contagious the 2 days before you actually have symptoms. That's why these annoying things are so important. When you feel fine, I don't have COVID, I feel fine. You actually might have it and be very contagious at the time. So again, 2 days before you develop symptoms, the studies have shown those are the most contagious times.
Thank you. And then we have several questions for Mr. Lange that might require your crystal ball, but they include, are we expecting to have a sports season?
That's very questionable right now. That's going to be totally up to Michigan High School Athletic Association. I know they're still selling tickets for the state basketball tournament, so we will see where that goes.
Okay. And Mr. Lange, if we go back to in-person learning and my child is homesick, is it required that he be tested for COVID-19 so he can return to school?
No, it is not required. What I would encourage is to stay in contact with that local district, either, that superintendent's office or that local principal's office. Just stay in contact, letting them know why your child's at home, making sure they're staying up in the homework and stuff of that nature, but a test would not be required at that point.
Okay. And then this from the community. My school just transitioned back to stay at home or online learning. Are we expecting this to be permanent through the winter?
My gut feeling would be no. I think we'll be back in session. It's just a matter, are we going to be back in session on December 9th? Is it going to be after Christmas? But I truly feel we'll be back. I don't think this will be for the full year.
Okay, thank you. Do our panelists, our awesome panelists, have anything else they would like to add in our town hall meeting today?
Well, I'd like to just add and kind of stretch out Duane's answer there a little bit and tie it all into wearing a mask and social distancing. This pause that the governor has asked us to do for 3 weeks is an opportunity for everyone in the community to do the right thing and to drop the politics and the conspiracy theories that this isn't true, because it really is true. The health department is not trying to drive up numbers to create, we're not here to create work for ourselves. We're here to prevent public health disasters. And we are in a disaster at the time. It's a pandemic. So this little pause is going to give us the opportunity. If we do the right thing, we can get those kids back into the schools and get in face-to-face learning. So it's really important that we heed this opportunity and heed the warnings that, hey, we need to wear the mask. The stores and operators need to wear the mask. It's really a slight infringement on your liberty to wear a mask. And I've heard that a lot. It's, violating my liberties. And well, just slightly, maybe it is, but it's going to protect you, your neighbor, and even yourself. There's people that we've seen reports on that are in the hospital that don't believe they have COVID. But the truth is, yes, you do have COVID. It's a pandemic, and we're doing all we can as a community to make it better. And it takes all of us to do that. So I just want to kind of add that this pause is really important so that we can get the kids back into school. We can get all these social things that we like to do, the bowling and the get-togethers, back on the map. But we have to really, do this in order to get to that point.
Thank you, Mr. Wilke. And I'll call upon each person for a concluding remark. Dr. Hammond?
Hey guys, I definitely think we're going to be seeing a lot more cases over the next few weeks and months. It's going to be important to just, as Bryant mentioned, wearing a mask, avoiding things that we know can help spread this virus. It'll be a different year. It'll be a different holiday season. We're going to have to sacrifice some of the things that we were used to doing, the close get-togethers, those large get-togethers, but really you have to be on top of this. It's a short-term sacrifice to help keep things as safe and as open as possible. And one more reminder too is that a lot of these local businesses are going to be hurting pretty heavily over the next few weeks and months. So especially these restaurants, the fast food places. So my personal advice is support them as best as you can. Order from them. Everybody knows how much I like Pizza Hut. Okay, I'm a big person there. Anyways, however, support our local businesses. Bypass McDonald's, go to Bob and Jamie's. Order from the bowling alley. We got to support these smaller businesses too, or else they're not not going to be able to survive financially. So really, just support each other by wearing a mask. Support our communities by supporting the businesses who are open, and just be safe. And these annoying masks are part of what they call the normal, but these are a temporary normal. Temporary normal. It's not the new normal, it's just a temporary normal until we get through this, okay?
Thank you. Superintendent Lange?
I mean, the big thing, if you have a child who's in the virtual arena learning at home, stay on top of that. Don't let them fall behind. The big difference between last year's shutdown in the spring, the homework assignments were optional. Now they're mandated. Students will be graded. We don't want high school kids or even lower level kids falling behind. That may jeopardize grades and or graduation. And another big thing, if your child isn't feeling well, stay in contact with those local districts. Talk to those principals, communicate with them, and let them know what's going on. Thank you.
And Dr. Hammond, another question came in. Can you discuss the need to take vitamin D and boosting our immunity?
Sure, yep. I've been a big proponent of that, actually. So there's a lot of studies that show that vitamin D3 in the range between 5,000 units, international units, and 10,000 international units IUs will help. So let me backtrack. They had a study that went on and analyzed the vitamin D levels of Steve Barnett has with him right there, zinc and vitamin D3. And the bottle's still sealed, apparently. He hasn't taken it yet. But what we do is the studies have shown that patients who were in ICUs, they drew vitamin D levels to see what levels they were. And those in ICU who were very sick with COVID had very low vitamin D levels. So there's some stuff that are thinking that if you have high vitamin D levels, vitamin D3, for instance, it's going to help protect against getting sick with COVID. Now, it doesn't mean you're not going to get COVID, but it might mean that you're going to get less sick with COVID. Same with the zinc, vitamin C, which are known immune boosters. It helps your immune system. Now, don't go and buy, expensive vitamins over the counter or online that promise they're going to do A, B, C, and D. Just buy, if you're going to buy one, buy vitamin D3 and zinc and use it as directed. Don't pop a whole bottle, think you're going to be safe from COVID. Just, and most importantly is take care of yourself. Practice exercise daily. If you smoke, quit smoking. All these things that will help really contribute to your overall health, which if you do get sick with COVID, you'll be in a good state of health to help beat it naturally.
Thank you. Dr. Barnett, concluding remarks for us?
Sure. Thank you, Louise. This will be an echo of really what you've already heard, but sometimes it feels in healthcare as if we're trying to take buckets of water out of Lake Huron in order to drop the lake level. And it's almost self-defeating because over the last few years, everybody over there knows that the lake level has been rising and rising at a faster rate than we can take the water out. And, for all the frontline workers, whether it's our EMS people or everybody in the hospital, when we don't see some level of compliance out in the community that Bryant and Dr. Hammond were talking about, it just doesn't feel good because we're on a daily basis and for the last 9 to 10 months feeling the same pain and anguish of walking around compromised, not being able to socially interact while we're on duty and trying to keep everyone safe. And if we go out in the community and find that those practices are not being exercised, it's almost as if, what the heck, So I'm just pleading with people to do these simple things that have been described and continue to be our best defense. We're looking forward to vaccination. I hope that people do the work that Dr. Hammond mentioned. Read, make up your own mind. Hopefully that results in getting the vaccine. And it takes some of the weight and heat off of those of us on the front line or putting ourselves at risk every day. So that would be my message. Thank you.
Thank you, Dr. Barnett. And for all of our panelists, I'm pleased to share a comment from one of our participants. They really appreciated today's program, and they appreciate McKenzie's work in expanding services to our county, and thanking us for clarifying the challenges that are being faced. So again, I would like to thank our expert panelists today for their time. I would like to thank each of you for turning in and asking your questions. Our next town hall will be December 2nd, and that will be a business forum. Nina Barnett from our Community Relations Office will kindly email our participants the link for this recording that is available. And again, I'm thrilled to say thank you, Mr. Lange, thank you, Mr. Wilke, thank you, Dr. Hammond, and thank you, Dr. Barnett, and our wonderful McKenzie Foundation for today's town hall.
Thank you, Louise.
Thank you, Louise, and all.
Thank you, Louise.
Yes, and that concludes our meeting. Have a great afternoon.